Hi, my name is Carla Wisemantel, and I'm a master's student at Eastern Kentucky University studying psychiatric mental health nurse practitioner. This is my evidence-based project proposal for 892. The clinical problem under review is adolescent-specific mental health concerns that increase the risk for suicidal behaviors and actions of self-harm. In 2017, suicide was the second leading cause of death for individuals 10 to 24 years old. 1 in every 100,000 children ages 15 to 19 die by suicide a year. Unfortunately, this is a very prevalent problem in adolescents, and it needs to be addressed. Multiple studies indicated that psychosocial interventions have the potential to be more successful than classical pharmaceutical interventions in preventing suicidal behaviors and actions of self-harm. The purpose of this project proposal is to investigate the benefit of psychosocial interventions compared to pharmaceutical interventions on suicide rates, attempts, and actions of self-harm within 3 months in the adolescent population. The supporting evidence for this project proposal consisted of 3 different studies, one of which was a level 1, a level 2, and a qualitative study. The level 1 evidence is a systematic review of psychosocial suicide prevention on interventions for the youth. It illustrates the effectiveness of psychosocial interventions within schools, communities, and healthcare interventions in reducing and preventing suicidal ideation, attempts, and actions of self-harm in children 12 to 25 years old. This is a great study because it consists of multiple random control trials of different psychosocial interventions, and they all indicate a positive impact on reducing risk in adolescents with mental health concern. The level 2 evidence is a randomized control trial as well, consisting of a attachment-based family and a non-directive supportment treatment for youths who are suicidal, and both of these psychosocial interventions indicated equally successful in reducing suicide and actions of self-harm. This study was really great because it had a good control group, reliable measuring instruments to give you accurate results. The qualitative evidence study consisted of gathering perception of adolescents, teachers, and parents towards the causes of suicide in secondary school children. And this was really great because it provided baseline information, which would allow us to further perform quantitative studies. The only thing about this study is it was based in China, and those adolescents and teachers interviewed probably do have different values, which could be reflected differently. The theoretical framework for this project proposal that I utilized was nursing care for patients at risk for suicide. It is a mid-range nursing theory by Sun, Long, Bohr, and Tasso. The main purpose of this framework is to guide nurses by emphasizing the importance of safe and compassionate care via the channel of the therapeutic communication and relationship. This implementation plan will consist of an interprofessional group with an adolescent psychiatrist as the leader, with an emphasis on a nurse practitioner to enlist study participants and collect data. This plan will also utilize physician assistants, social work, and therapists. Bi-weekly meetings are going to be utilized to evaluate the effectiveness of assessments, screening tools, resources for interventions, outcomes, and safety measures. The location for this study will ideally be a outpatient adolescent mental health facility that is able to provide appropriate staff that can assess risk using the Colombian screening tool, implement the correct psychosocial interventions under review, and evaluate overall safety. The cost and supplies are going to be dependent on the specific psychosocial intervention utilized. This plan will consist of recruiting adolescents with mental health issues that put them at an increased risk for suicide over an 8-week period utilizing the Colombian screening tool. The interprofessional team will then review and determine a specific psychosocial interventions related to the population under review. We will then ensure patient confidentiality, any ethical considerations, and that the child has been informed of consent at a level they can understand, as well as establishing informed consent with their legal representative. We will then begin to implement the selected psychosocial interventions over 3 months while evaluating patients' outcomes weekly with the Colombian screening tool. After 3 months, we will then evaluate and make any needed changes. Below, you can see the Colombian screening tool, which will be utilized to measure all of our outcomes, including recruiting our patients in the study. Outcomes will be measured weekly with the screening tool. And then the right top corner, you can see my Gantt chart, which consists of my time frame for this study. The study will pretty much consist over 3 months. However, we do have the total 4 months just so we can start recruiting those individuals and get that study started. So at top, you can see that we have those bi-weekly meetings consistent throughout July, August, September, and October. And then we will begin to identify and recruit our patient population over those first 8 weeks, which will begin in July and then continue into August. And then August, we will officially begin implementing those psychosocial interventions. And then August, September, October, we will be reviewing those outcomes in our patients using that Colombian screening tool. And then in the final month of October, we'll review anything and make any needed changes. Below the Gantt chart is my references, and I hope you all enjoyed this. Thank you so much.